and happy Sunday afternoon. It's a beautiful day out today, so I decided to sit outside for a little bit to chat with you guys. So, we are doing a COVID vaccine update primarily today, but as always, I'm going to give you guys just kind of an update for where we are here over the last week or so. And basically, that we are full. The hospitals, the ICUs, pretty much across the state are very full. COVID patients are taking up a much larger majority of those beds in the hospitals right now. Obviously, they're not the only patients that are in the hospital, but certainly with the combination of increased COVID cases and what has resulted in increased hospitalizations from that, we are full. So the health department has put in another mandate to delay elective procedures that require overnight stays in the hospital that will go into effect on Tuesday of this week. And they also just put into effect a specific care system that's designed to give people, or hospitals rather, a way to kind of better coordinate and find places for patients to go when their hospital is full or can't provide the level of care that they need. And this is a good thing, but we've been doing that most of the time, so it is going to be a little bit different now in that we are just kind of having to make room for patients as best we can. So it is a sad situation that we've gotten to. I really hoped that we wouldn't get to the place that we are in right now. So all I can do is really encourage you guys to be safe and be careful. Continue to wear your masks and avoid any unnecessary gatherings at all. Even the people that you're around with work, when that's necessary, be really cautious. Don't let your guard down. If you're planning to do things for Christmas and see family, keep your gatherings really small. Be really mindful of your actions. Try to stay isolated and kind of quarantined on your own before you kind of engage in any of those activities. So I just really encourage everyone to pay attention and be careful in your other actions too. If you have some kind of injury, there's a good chance that in certain places you may not be able to get the care that you need. So be really careful just in all the things that you do, not just the things that relate to COVID. So, I'm going to give you guys some of the basics on the COVID vaccine. We definitely have some more information available now, and it's going to be a lot of stuff that's coming at us over the next several weeks and several months. So, just a general update. Most of you have probably seen this information on the news, but just hopefully to keep it simple and basic for you guys, the vaccine is going to come out in different phases. And so the initial phases are going to focus on the highest risk individuals. So that's going to include our high risk and frontline healthcare workers that are taking care of COVID patients and interacting with a lot of patients, and then other healthcare workers and individuals or patients who are in high-risk community dwellings like nursing homes and those types of facilities. So those are going to be the people who are going to get the vaccine in the very earliest phases, and then it's going to gradually kind of go down the pathway from there to other healthcare workers, patients and general public who are over 65 and or have high risk conditions, and then slowly trickle down the age groups and health conditions and that kind of thing until we ultimately get to where it is publicly available to anyone who wants it. The best guess that I think we have on how long that process is going to take is that we will probably start to see later this week some of the healthcare force begin to get vaccines, and then more than likely it's going to take all the way through kind of the spring, potentially into April and May before we're really getting enough vaccine out to give to the general public population that is healthy. The one that has come out so far and has gotten its emergency authorization approval from the FDA is the Pfizer vaccine. The Moderna vaccine is scheduled to be reviewed, I think it's this Thursday on the 17th. So if you're interested in that and more of the details, I do think that the FDA is actually publicly streaming those reviews and meetings. So if you want to learn more about it or see more about how the process goes, you can certainly look into that. But they should meet this week to go over the Moderna vaccine. I think we anticipate that there's not going to be any issue with that emergency authorization. And then at that point, we'll have 2 that have been through the approval process, and that we'll start to see being put out for those initial phases. The initial phases are primarily going to be distributed through hospitals and through pharmacies to the highest risk populations in the nursing homes and everything. And then slowly we'll begin to see the vaccine come into doctors' offices like mine. So we turned in our application to be a vaccine provider last week, and are just kind of waiting to hear back and learn a little bit more about how that process is going to go. There are a number of clinics and stuff throughout the state that are going through that process. So it's definitely going to be available through that avenue, or through pharmacies or health departments and that kind of thing. But it is going to be a little bit of a process that we are still waiting to kind of get the final information on when we'll get that and who we will be giving it to as providers and that kind of thing. So there's definitely still a lot of information that we're waiting on the final answers to as far as that's concerned. The biggest goal of the vaccine is going to be to prevent the severe illness and prevent illness that is so severe that patients need to be in the hospital. So it's very similar to how we approach a lot of the other vaccines. The flu vaccine probably is the most common one that you guys are familiar with. The goal, yes, is we want to prevent people from getting the flu to begin with. But one thing that I think is important to emphasize that I heard in one of the updates that I was listening to this past week is that the vaccines don't prevent infections. So you still certainly will get infected where the virus is in your system, but the goal of the vaccine is to prevent it manifesting as the disease. So it works with your immune system to build up the antibodies that you need to kind of quell the virus and get rid of it so that it doesn't reproduce enough in your body to create the actual disease that it causes. So that's a really important distinction that we don't always think about, especially those of you that aren't in the medical field. So biggest goal is to prevent the severe disease and prevent hospitalization. So we're certainly still going to have people that get it and potentially could even still be contagious, but we're really hoping that this will decrease the burden on the healthcare system and the burden on patients from having so many of the complications that we're seeing from the virus. Kind of the biggest thing that we are seeing, I think, when we're starting to talk about the vaccine, are people are really hesitant to get it and don't know if they feel like it's safe, or they're worried about getting it for a number of reasons. And this has been something that's common with vaccines throughout history. And so I will say, just on that topic, we have come a long way in vaccines. I mean, this year has been astounding in how fast the scientific community has been able to come together and share data and information to come up with new ways and use old ways that we already had to make a vaccine really quickly and study it actually pretty well. This was one of my kind of biggest hesitancies and worries about us developing a vaccine so quickly, is that, you know, we want to make sure that we have studied it in enough people over at least a sufficient amount of time to really look for the safety or the potential risks that may occur with it. And so after I've kind of looked at a little bit more of the information and listened to some of the updates from some of the experts in the field, I feel very comfortable that it's been well studied. The development process has been really, really good and handled well with all of the people that are working on it. I can't imagine what their day-to-day life has been like over the last 10 months working on this and trying to get it out to us so quickly. But I think the number of people who have participated in these trials and the fact that they have been ongoing now for over a couple of months is really promising, and I'm really going to encourage everybody to consider getting the vaccine. The biggest question I think that I get are, you know, what about the side effects, or what about the potential risks of it? And so it's important to, number one, know that the majority of really serious side effects or reactions that we see with vaccines typically are going to occur within the first 2 months after vaccination. And we've had that long in the trials, and there has not been any significant adverse event. The second thing about those types of reactions are that they're typically things like a 1 in a million chance to have something like that. So reactions like that can occur with most any vaccines, but they're extremely, extremely rare. And so in that regard, they are going to be safe from the standpoint of how we generally evaluate that. Now, the most important thing for everyone to know who is thinking about getting the vaccine or already knows they're going to get the vaccine is more than likely you are going to have some side effects. So, just like some people have with some of the pneumonia shots, the shingle shot especially, you're going to have some body aches. There's a good chance you're going to have some site reaction where you get the injection, where it may be red and maybe a little bit warm, swollen. You might feel bad for a day or two, and it may even be to the point that you need to take off work because you feel so bad. So that's one thing that we really want to emphasize to the general public is that you probably are going to experience side effects, and that's to be expected because it's really working to get your immune system going, and that's what happens when our immune system responds to things is we kind of get some symptoms. So that's one thing to expect. And try to educate other people when you're having conversations that that's going to be a normal response to the vaccine. Let's see here. Some of the questions that I've gotten, I'm going to go through those. What about giving the vaccine to my children, or if I'm pregnant or thinking about becoming pregnant? The studies have not evaluated the vaccine in anyone under 16, I believe. There may be one that has started allowing patients at the age of 12 and older, but the FDA has not made any indication that they're going to improve the vaccines so far for the pediatric or adolescent population. So that's one group of people that we're not going to be able to vaccinate yet. Also has not been studied in pregnant patients or lactating women. So that's one other group of people that we just don't have the information to go on yet. So those are going to be some of the people that are going to be excluded from getting the vaccine, at least first and early on. So you want to, if you are around people that are in those age groups or those categories of people, then you really want to consider, getting it yourself so that you can offer some protection to them by keeping yourself from getting it too. Another question that I've gotten is, should I still get the vaccine if you have had COVID? And so all the recommendations thus far recommend absolutely yes. Even if you have had COVID, you should get the vaccine. In general, we're going to probably recommend that you wait at least 2 to 3 months before you get the vaccine. But absolutely, if you've had it, it's going to be a good idea for you to get. Let's see. Another excellent question is, am I still going to have to wear masks and continue to social distance? Absolutely, yes. So it's going to take us a while to get enough people vaccinated that it's going to make a big impact on things. So certainly because of that process, and then we certainly, don't have the long-term data after people getting the vaccine on how long our immunity is going to last. We don't know yet if it's going to be a seasonal thing like the flu or something that you get every few years to continue to prevent infection with COVID. So absolutely, at least for the time being, I would absolutely continue wearing a mask. Be very cautious in your activities, keep your distance, and all of those things to continue to keep yourself and your family and close friends safe. So absolutely continue to do that. I don't see that going away at least for 6 more months, maybe even another year. Let's see, what other questions? I've had several questions about just, should I get the vaccine? I'm this old, or I have these conditions, or my family member has this condition. So should I get the vaccine, or should my family member get the vaccine? And in general, there's going to be a very small number of people that we would say, no, I don't think it's a good idea for you to get the vaccine. Some of that may depend on which vaccine it is. And so that's one thing to just make sure that you communicate with your doctor about, or whoever you're going to get the vaccine from. And make sure if you do have questions or think you might fall into one of those groups, just always ask. That's a good way to kind of figure those things out, because it may depend some on which vaccine you are getting. So I never get mad if somebody asks questions like that. But in general, like I said, it's absolutely going to be recommended for pretty much everyone, every group, every age, every condition. Now, I will comment on, I think, some of the things that have come out in the news about some of the kind of true allergic or anaphylactic reactions to the vaccine. And that certainly is a possibility. So there have been some reports of people with a high number of allergies, or people who have had anaphylactic type reactions to vaccines in the past, that they may be more likely to have a reaction like that. So that is one thing to definitely talk with your doctor about before you get it. If you are someone who has a lot of allergies to medications, or you have had reactions to certain vaccines in the past, you definitely should discuss that with your doctor before you get the vaccine, because there is a possibility of that. Certainly, if you're a patient who carries an EpiPen, make sure that you have that with you when you do get it, just to be safe. Let's see here, my list of questions. The cost, which is a great question. So the vaccine is going to be provided widely to everyone and supplied by the government. So it is not going to cost anyone anything to get the vaccine itself. Clinics and things like that can charge insurance companies for what we call an administration fee, because it does take us, some manpower to be able to administer the vaccine. And so from that standpoint, that is a charge that can be applicable. But to my knowledge, every insurance company is going to cover that. So cost should not be an issue or a barrier to anyone. So that is one thing that we should not have to worry about. Another question that I've gotten is if it will be a live vaccine. And to my knowledge, there are no live vaccine trials that are currently going on. So live vaccines are those that have actual live particles of the virus in them, and a very tiny amount gets injected into your system so that your immune system responds to that. So the only two live vaccines that we still have around and use commonly now are the chickenpox vaccine and the MMR, or measles, mumps, rubella vaccine. Those are the only two that we still use on a regular basis that are lab vaccines. And so a lot of the time, those take a lot longer to develop and create. And so from that standpoint, they're not as practical. They do carry some risk for more significant reactions and that kind of thing. Those two, the chickenpox and MMR vaccine, that have been around for a long time, have been very well studied, and we know a lot about those. So I think from my standpoint, I'm glad that we're not using any live vaccines in the COVID era for that specifically, just because that is one that may take a little bit more safety data and information to get. So no live vaccines here as far as I know. And then the biggest question that I've gotten from a lot of people is if I am going to get the vaccine. And absolutely, yes, I will be getting the vaccine. Just to be completely honest with everybody, I absolutely have kind of gone back and forth in my mind about it, just weighing the pros and the cons, because there's definitely some risk associated with it. But there's also risk associated with not getting the vaccine, because who knows how me or you might respond if you came down with COVID. So after a lot of thought and careful consideration, looking at some of the information, listening to some of the updates, and absolutely having trust in the FDA and our scientific community that's been working on developing these vaccines, I absolutely intend to get the vaccine. So I'll definitely keep you guys updated on how I do with that, and take some pictures so I can prove it. So I hope that was helpful. I really encourage you guys to get the vaccine. Continue to ask questions if you have them, and just keep wearing your mask and keeping your distance. No big parties, please, and stay safe. Have a good weekend.